Hello, everyone. Thank you for joining us today for USDTL ToxTime. I'm your host, Grace De La Pena. Today's presenter is Dr. Joseph Jones, Chief Operating Officer with USDTL. He will be discussing the detection of fentanyl in hair specimen. Without further ado, I would like to turn this over to Dr. Joseph Jones.
Thank you, Grace, and welcome everyone. Welcome to our next version of ToxTime. I'm Joseph Jones, Chief Operating Officer here at USDTL. Let's get started. Today we're going to talk about the detection of fentanyl in hair. So by now we're all acquainted with this opioid epidemic that we see in the news every night. And a lot of this has been a logical conclusion of a lot of different events and steps that's happened over the past couple of decades. And in my mind, it started with the addition of pain as a vital sign. And the gap was rapidly filled with oxycodone. Then it was filled with the extended release oxycodone. And unaware to a lot of people, they were becoming addicted to a very powerful narcotic. Once the clampdown on oxycodone began, brown tar heroin began to come into our country. And we had a ready-made population right to buy this new, cheaper, but yet potent brown tar heroin from Mexico. Once that became a little better under control, fentanyl came on the scene. And this fentanyl has been growing over the past few years. Very dangerous drug. But the advantage for the drug traffickers is that one chemist and one laboratory can replace acres of illegal crop, and the teams of people that are required to tend and harvest this crop, in addition to the facilities and the teams of people there, required to convert that crop into the drug we know as heroin. Fentanyl is much more potent. It's rather simple to make, and it's more potent, it's smaller, it's easier to conceal and traffic. So for these reasons, there's been an advantage of migrating from heroin over to fentanyl. So what is this fentanyl? Fentanyl is a synthetic opioid, and it's a very useful pain medication. It's used for anesthesia. They even use it in labor and delivery in some cases. But where we get into trouble is with recreational use. It is very potent, and if a mistake is made in the formulation, a lot of trouble can come from it. We find it mixed with other drugs such as heroin and cocaine. But this drug is 100 times stronger than morphine, 50 times stronger than heroin. So this creates a lot of problems on the street. So much so that back in 2015, the DEA issued a nationwide alert on the danger of fentanyl. They said that drug incidents and overdoses related to fentanyl are occurring at an alarming rate throughout the United States and represents a significant threat to public health and safety. Reports of fentanyl are aggregated by the National Forensic Laboratory Information System. They capture a lot of the seizure data and drug testing data around the country. And as you can see from 2014 to 2019, there's been a significant increase of reports of fentanyl back to the NFLIS. Many instances of the fentanyl reports, it is co-reported with another drug like heroin or cocaine or methamphetamine. So we can see that along with these increases with the fentanyl reports, we also had combo reports where the fentanyl and heroin was reported in a case, or fentanyl cocaine or fentanyl methamphetamine. Now the interesting thing about this chart is that between 2018 and 2019, the fentanyl goes up like it does to previous years. But if you'll notice, the combo reports of fentanyl plus heroin actually went down. So this is telling me that fentanyl just by itself is increasing in popularity on the street. In 2018, the CDC declared that fentanyl was the most dangerous drug in America. So why did they say that? So we can see here in 2011, we had 1,662 overdose deaths due to fentanyl. We see the oxycodone was the most prevalent overdose death in the country, with a little over 5,000 noted with the green circle. Heroin was just below 5,000, noted with the purple circle. Moving forward to 2012, we'll see that the effects of clamping down on oxycodone also resulted in an increase in heroin as people were shifting over from using oxycodone, OxyContin, over to using the brown tar heroin. Fentanyl, you can see, is still flat. By 2013, heroin is outpacing oxycodone as oxycodone overdose deaths continue to decrease. Fentanyl starts to creep up just a little bit. By 2014, fentanyl makes a big jump up to 4,223, but heroin is by far in the lead with over 10,000 deaths. Oxycodone is still flat. Oxycodone remains flat in 2015, but fentanyl now has more overdose deaths than oxycodone. So this was brand new in 2015. We had 8,251 deaths. Now heroin is still king with almost 15,000 overdose deaths. But in 2016, fentanyl surpasses heroin. And they had 18,335 overdose deaths reported just from fentanyl. So based on this data, the CDC made a remark in the paper noted at the bottom of this slide that fentanyl is the most dangerous drug in America. So why is fentanyl and its analogs appear to be so much more dangerous than these other drugs? Well, one thing is that you have a fentanyl-induced respiratory muscle rigidity, which is also called wooden chest syndrome. When someone gets a concentration of fentanyl above a certain level, the muscles around their chest will tighten such that you're not able to properly ventilate, which makes this a deadly situation if you can't breathe. Additionally, there's something called the laryngospasm, which is also called vocal cord closure. Now, this is a spasm of the vocal cords where they slam shut, and it makes it very difficult to speak or breathe. So this can be deadly if it goes on for long enough. This seems to be unique to fentanyl and its analogs. Now, analogs are compounds that are structurally related to fentanyl, and you'll hear people refer to them as fentalogs. And over the past few years, there's been dozens of these fentalogs that have come out. But this wooden chest syndrome, laryngospasm, it's life-threatening because if it clamps down and you can't breathe and your chest doesn't expand, you're going to suffocate in a couple of minutes. And unfortunately, it does not respond well to naloxone or Narcan. I was at a conference this past summer and I saw a very intriguing presentation on this vocal cord closure. There was a paper being presented at the College on the Problems of Drug Dependency, or CPDD, and they were showing where they were using male Sprague Dawley rats, anesthetized, and they inserted this fiber optic camera into their throat to visualize the larynx. And then they administered several different drugs to these rats and used this as a video platform to try to see exactly what effects and what the impact of these effects of the vocal cord closure has on these animals. And so they had a couple of different doses of fentanyl at 5, 25, 50 micrograms per kilogram. They also used a 5 milligram dose of morphine. They had saline that they used as a blind, and then they had the naloxone to see what effects that the naloxone had on the vocal cord closure. The citation for the paper that they were presenting is noted at the bottom of this slide here. Very interesting read if you'd like to pull it down. So what is this laryngospasm or vocal cord closure all about? So there was a really nice video. I'm sorry I was unable to get access to it to share with us today, but I'll describe what I saw on the videos. And so when you've got the video looking down into the larynx of the rodent, you can see the two vocal cords. And as they're breathing, you can see the vocal cords kind of pulsing with their breath and their heartbeats. And whenever you speak or make a noise, they tighten up and you can see them vibrate. And that's how the noise is produced. But in the case of the vocal cord closure, those vocal cords, they just slam shut. And you can see that the air is not going in and out through that. And it's kind of dramatic looking when you look at it. So that's what vocal cord closure is all about. So now for the results of this study. So when they administered saline to the rats, as we would have expected, we did not see any vocal cord closure. And of course, the mortality rate under that circumstance was 0. Additionally, when they administered 5 micrograms per kilogram of fentanyl, they did not observe vocal cord closure. And so, of course, correspondingly, the mortality rate was 0%. The administration of 25 micrograms per kilogram, the onset of vocal cord closure happened in 8.7 seconds. And in those circumstances, all 7 rats perished, mortality rate being 100%. Expected when they increased the dose up to 50 micrograms per kilogram, all 6 rats suffocated and the vocal cord closure initiated at 8.5 seconds, and all 6 of them died. 5 milligrams per kilogram of morphine was administered. They did not see a vocal cord closure. You can see in the video that they shared at the conference where the vocal cords did react and you could see them getting tight, but within a second or two they released, and none of these rats died. The next experiment involved adding naloxone prior to adding fentanyl at 25 micrograms per kilogram. Interestingly, when you pre-treated the rat with naloxone, they did not observe any vocal cord closure, and all 3 of those rats survived. However, when naloxone was administered following a 25 microgram per gram dose of fentanyl, the vocal cord closure was delayed a little bit, but ultimately all 3 of those rats did not survive. And even when doubling the dose of naloxone following an administration of 25 micrograms per kilogram of fentanyl, none of the 6 rats survived. So these researchers have developed a very interesting platform to study the potential for treatments for individuals that are overdosing on fentanyl. While non-clinical models have their purpose, understanding the effects of fentanyl in humans is obviously a very important thing for us to understand as well. But before we do that, we should take a quick peek at just how drugs are incorporated into hair. Drugs and their metabolites are incorporated into hair from 3 primary routes of incorporation. First and foremost is environmental exposure. If you are in an environment where drug is being smoked, handled, distributed, cooked, manufactured, etc., that drug will migrate from the environment directly to your hair, attach itself to the proteins and pigments in the hair, and is available to be harvested and analyzed immediately. Route number 2 is the sweat and the oil from the scalp. These fluids contain drug and drug metabolite very similar to urine. And as these fluids bathe the hair shaft, they deposit the drug and drug metabolites into the hair, works its way into the nooks, crannies, and pores, binds to the proteins and pigments, and is available to be harvested and analyzed. We begin to see those show up a few hours following a dose. And lastly, blood obviously contains drug and drug metabolite. And as the blood travels through the root of the hair where the hair is originating, it will incorporate, bind itself to the proteins and pigments. And once that portion of hair emerges past the scalp line, then that portion of hair is available to be harvested and analyzed. At the end of the day, we have 3 very different modes of incorporation superimposed on top of each other. And so it's a very complex picture. Hair growth rate is approximately a ½ inch a month, At our laboratory, we only analyze the first 1.5 inches closest to the scalp. So just based on that, we limit our detection window to approximately 3 months. One of the biggest questions in hair testing is, are the analytes that we're seeing in the hair there due to environmental exposure, or was the donor actually ingesting the drug? In the case of fentanyl, it requires a liver to convert fentanyl to norfentanyl. So if we only detect the presence of fentanyl, that is conclusive evidence of environmental exposure. So maybe they were in a room where some heroin was being smoked that was laced with fentanyl, or cocaine, crack cocaine laced with fentanyl was being smoked, or maybe they're handling fentanyl for whatever reason. However, if we find norfentanyl, that means that it's been inside the body, has been metabolized by the liver, and has been laid down in the hair by the sweat, the oil, or the blood. So now let's switch gears a little bit, and let's take a look at some research that can be found in the literature. These are some papers that caught my eye. There are obviously more than this in the literature, but these are ones that caught my eye. So the first one was published by Wang and I way back in 1993, and they were only using immunoassay as evidence for fentanyl in hair for surgery patients. So they had 13 surgical patients that were administered between 1 and 6 milligrams of fentanyl during surgery. They collected hair from between 7 and 273 days after surgery. They conducted segmental analysis, and they analyzed these specimens using a technique called radioimmunoassay. The range of concentration of fentanyl that they found in hair ranged from 13 picograms per milligram up to 48 picograms per milligram, but for only 8 of the patients. The other 5 patients, they were not able to detect the fentanyl. They also reported that they did not observe a dose response. And what that means is that the result seen in the hair was not proportional to the amount of fentanyl that they were given. Just like with all other drugs in hair testing, we do not see a dose response. There are other variables that are much more powerful than the amount of drug that was given, such as hair color and hygiene. So this is what no dose response is observed. And this is what we see day in, day out, even 20, 30 years later. Here we have a simple case report reported by Schneider and his team back in 2008. So they had a 44-year-old male who was receiving Duragesic patches, which is a patch that contains fentanyl. And he wore these patches for 55 consecutive days for a chronic heavy toothache until they could deal with the toothache. Again, they collected the hair segmental analysis, and the highest segment of hair contained 480 picograms per milligram. So this is kind of interesting to look at these two cases, these two research papers, to kind of understand what orders of magnitude of drug do we expect to find following these different types of doses. A paper that was published in 2018 from a team in Italy, they were looking at a survey of New York City party attenders, and following the consent and completing a drug history survey, hair specimens were collected. They focused on the donors, the participants that reported past year non-medical opioid use, and there were 17 of those individuals. They detected fentanyl in 2 of those specimens, and here is what they found. They reported fentanyl at levels of only 3 picograms per milligram for case 1 and 6 picograms per milligram for case 2. In both of these cases, the donor was positive for morphine 6-mem and codeine, which is indicative of heroin use. So these donors must have been using heroin that had been laced with fentanyl. So this is an interesting view of how much fentanyl we would expect to see from this type of a donor. The last paper we'll talk about here today was, again, the group in Italy, Salamoni et al. They collected specimens between 2016 and 2018, and they were looking for cases where there was self-reported heroin use or the specimen had already tested positive for common opiates. They had a group of 293 specimens. 198 of these specimens tested positive for at least one fentanyl. And a fentanyl, as I mentioned before, is a compound that has a very similar background structure of fentanyl, but it's tweaked just a little bit so that's a little different, like carfentanil, alfentanil, sufentanil. All 98 of these, however, were also positive for fentanyl itself. So if you're just looking for fentanyl, you'll pick up the positives. You may pick up some double positives, say like fentanyl plus alfentanil or fentanyl plus remifentanil. But if you're looking for fentanyl itself, you'll catch all the positives. That was a good takeaway from this paper. But the amounts of fentanyl that they found, here's the results for that. In this group of positive specimens reported by the Italian group, the median concentration of fentanyl was 95 picograms per milligram, with the highest results ranging up to near 1,000. For the metabolite norfentanyl, the median concentration was 15 picograms per milligram, with highest concentrations ranging up to 100. So the important thing here is that this is the first reference that I saw in the literature that really described the ratio of fentanyl and norfentanyl when it's found in the hair. And what we're seeing is roughly a 5 times difference in these concentrations. So practically speaking, when we're interpreting these specimens, we need the presence of norfentanyl in order to have conclusive evidence of ingestion. So if you've got a case where the fentanyl is close to the cutoff, then the norfentanyl may be negative simply because it's below the cutoff. So we have to keep that in mind when we are interpreting the data. Now, let's take a look at the trends of what we're seeing here at USDTL. Between 2015 and the third quarter of this year, we have seen the demand for fentanyl testing increase almost threefold. What this tells me is that our clients see fentanyl testing as becoming more and more important, and that you see that fentanyl is a growing concern. This chart, in a large part, determined the topic of today's ToxTime. Another interesting trend that we are seeing at USDTL is that during the apparent COVID and post-COVID environment, the positivity rate for fentanyl has quadrupled. And so this just can't be a good thing. And this mirrors a lot of the increases that we see in overdose deaths and other incidences of fentanyl reported problems. Lastly, let's take a look at when we find fentanyl, how much fentanyl do we find? And so comparing this to the previous numbers, keep in mind that the donors that submit hair specimens to USDTL do come from a high-risk environment. They're being evaluated for intake into a treatment, they're under monitoring, or they're under court order, etc. So we may be seeing a little bit more of an enriched population than you would see maybe in other populations that you would test. However, it is interesting that we also see fentanyl in a much higher concentration than norfentanyl. The median concentration of fentanyl in our demographic is 418 picograms per milligram, with the higher levels a little over 3,000 picograms per milligram. The median for norfentanyl is 40 picograms per milligram. So again, if you have fentanyl results that are just above the cutoff and the norfentanyl is negative, it could just be that it's because it's 10% of that result and simply below the cutoff. We don't have evidence, but that can be important when you're trying to figure out what's going on with your particular case. And of course, this was using 466 positive results that we have reported since the beginning of this year. In conclusion, fentanyl use is increasing. Fentanyl use seems to have spiked during the COVID pandemic. Hair is a useful specimen to detect fentanyl. The presence of fentanyl in hair is evidence of environmental exposure. The presence of fentanyl and norfentanyl is evidence of ingestion. The concentration of fentanyl itself is roughly tenfold higher in hair than norfentanyl. Now, we know that this was a lot of information, and we understand that substance abuse toxicology is complex and sometimes confusing. It is our goal to be a resource for you and your staff. As pioneers in the field of substance abuse toxicology, we host these educational events to help answer your questions and clarify differences in testing. I will now pass you off to Fahmida Matani, our Business Development Supervisor, to expand on some of our other educational resources. Fahmida?
Thank you so much for that amazing presentation, Dr. Jones. My name is Fahmida Matani, and I am a Business Development Manager here at USDTL. One thing our clients often tell us is that they love that USDTL provides great educational tools to help them and their businesses grow. One such tool is free specimen collection training and certification. The process is simple and easy to follow. Once trained, you can take our online quiz and get a certificate of completion upon passing. We have trainings available for fingernails, hair, dried blood spot, and urine collections. To set up a training, please reach out to our team.
Like and subscribe to our channel to receive notifications about new videos.